different range. Okay, there's 6.9 to 8.1. What's most important is to know what your high end is. So for dogs, 10.7 is your high normal. Cats, 8.1 is your high normal. Everything after that will be considered big. Okay? Now we got these 0.1s and such, but it's really just going to be a guesstimation on your part, okay? But you want to get as accurate, or so to speak, as possible. But again, all of these are really subjective, and all of these are just really based off of patterns that have been seen over time. Somebody else? Yes.
You stated earlier that we're going to count from T4, the vertebral body, you said? You counted until about 4.5 steps?
5.5.
5.5.
For the long axis.
Okay, and then you said 6. Where did the 6 come?
The short axis.
Okay, so you mind?
Yes, ma'am. So we came from the short axis, it's going to be perpendicular to the long. Okay? And we started at the ventral margins of the caudal vena cava, and we extended that line to the cranial margin, right? We take the same line, we started the cranial margins of T4, and we count the vertebral bodies going caudally. Got it?
So you're literally in the computer going through the line.
You can do that, or just keep it old school if you want, and put your piece of paper up.
Okay.
So if you were at your computer, you would do something like this, tick, something like this, tick, and then put them up here and count to your tick mark.
That's where I was going.
Yeah, and that's fine. We're gonna practice this because it does get a little confusing until you have had it a couple of times. All right. So just remember those parts: long axis, short axis. Knowing where the carina is, where the caudal vena cava is, where the apex, where the cranial margins, and where T4 is, okay? And then you know where your upper ends of normals are. All right, so let's talk a little bit about localizing. And I think we're gonna probably get enough of the clock analogy before we have to stop, and then we'll continue on Monday. And then we'll kind of follow up with an activity before we start talking about abnormals, okay? So Dr. Perry is probably going to start introducing diseased hearts on Wednesday. All right, so we'll kind of take a break before we start hitting you guys with all of that disease information. And then keep us on track with our anatomy and such. All right, so localizing the abnormals. Remember I said we want to kind of have an idea of what's causing change, right? Because then that helps us identify what side or what parts of the cardiovascular system is causing us problems. So remember, clock analogy is typically used for locating the chambers and the great vessels, most commonly used with the DV, which is our preferred image for cardiac structures, or on the VD, okay? Now I say preferred, but remember, you want to keep things as systematic as possible. If you are in a clinic where you guys typically take a lateral, right, most commonly like a right lateral, and a VD, it is okay to assess your cardiovascular structures on there. Why? Because it's going to be easier for your brain, who's used to seeing these images in this way, to identify something abnormal versus switching it up every now and again when you get that cardiac patient, and now the heart looks different. So remember, on one view it looks a little more elongated, and on another view it looks more squat and rounded. A lot of times, if we're used to seeing the VD and that more elongated heart, when we throw ourselves a DV, then we're like, oh shoot, something's wrong with the heart. It looks more rounded. Okay? And then there's other structures that look a little bit more pronounced versus the other when we're not used to seeing them. So it is one of those recommendations that you either make it a very clear-cut rule. If you're dealing with cardiac cases, you do DVs so that you get your minds prepared for that. If this is something otherwise, then VDs are okay to do. But if your technician goes in there and accidentally throw you a VD, because that's what they're used to giving you, don't chew them out, don't chew their head off yet. Okay? Just bear with them, because you can still make your assessment off of that. All right? So clock analogies. We typically like to use these, or you most commonly see them used with the VD or the DV views, okay? And then being able to recognize your normal is key to this. All right, so these are some schematic drawings kind of overlying a radiograph from an old textbook, okay? And some of your key structures that we're going to talk about are listed here. You guys will eventually get this PowerPoint, so don't stress yourself on trying to write down everything or type down everything. And some of the stuff you guys kind of had. All right, so this was my best way to show this clock over these drawings. All right, so you're going to think about this clock, an old school clock with the numbers 1 through 12 on there, and you're going to, in your mind, you're going to picture this, okay? Sometimes you may even have to draw over your heart to see where you're at. So we're going to follow the clock from the 12 o'clock mark and start going around in a circle and identifying our normal structures. All right, so we know on midline, between 11 and 1 is going to be aortic arch. That's going to start my merry-go-round. I'm going to go aortic arch, and pulmonary artery, the left auricle, which is going to represent my left atrium. Remember that, okay? Left atrium technically sits, when we're looking at it on a VD or DV, it sits in the midline, caudally, okay? But left auricle, when enlarged, will represent any left atrial enlargement, all right? Well, will represent most left atrial enlargement. Let me correct that. So the next in line is going to be left ventricle, then right ventricle, right atrium. See how I just went in that merry-go-round? Okay? So just kind of remember your merry-go-round, and then you guys start getting yourself together. Fortunately for you guys, we still have some outdated clocks, so you always have a clock to reference in one of your classrooms. And see, you need a visual. Here's my clock. All right? So this kind of gives you those time stamps. So starting with 12 o'clock at midline, when you're looking at your DVDs, that's where you start your merry-go-round. As you can see, the aorta comes out just shy of 11 o'clock and then goes around. Now, if we start seeing this bulge in these areas that kind of go out of the scope of that cardiac silhouette, then we're going to start identifying abnormals. So, say I have main pulmonary artery enlargement due to heartworm disease. I'm going to describe that on radiographs when I'm looking at my VD or my DV as a bulge, okay, from the 1 to 2 o'clock position of the clock. Okay? The person reading that will be able to say, okay, she's looking in the area of the MPA, okay? And that's going to be her main pulmonary artery. So say you forgot to put the MPA in your description here, but you're going to say a bulge from the 1 to 2 o'clock, suggestive of main pulmonary arterial enlargement. That's how that would be worded. All right? And then I say, well, there's a bulge from the 6 to 9 o'clock position. That's typically indicative of right ventricular enlargement. So I think this dog has a more progressed state of heartworm disease. Now you should see that inverted D. I gave you guys some insight. All right? So that's how we use the clock analogy to further identify what's causing that cardiomegaly. Okay. All right. The one that's not so commonly used is going to be the lateral view in regards to the clock. Where right here, we're just really using it to kind of look at where our chambers are. Okay? So 12 to 3 is typically going to be that left atrium. 3 to 6 is left ventricle. 6 to 9 is right ventricle. 9 to 12 is right atrium. But on the lateral views, we have so much more that will help us really focus in on which side of the heart is enlarged. Okay? So what you guys will see me talk about more on Monday, just in the interest of time, is the position of the carina. Okay? If that's enlarged, we're thinking something more left-sided, like the left atrium is most commonly caused for the carina to be pushed upward or displaced forward. But just know that there is a clock analogy that is used with your lateral view. Okay? But again, the most commonly used one is going to be that of the VD and DB clock analogy. All right? Any questions so far? Yes, no, maybe so? All right. Well, on that note, so that we can all get to grand round, the marathon never stops. We will continue this talk on Monday. So on Monday, we'll be prepared to finish talking about our normal parameters. We'll have a little activity with a couple of images where you guys can practice doing vertebral heart score and assessing for cardiomegaly or microcardia. And then Wednesday, we'll be prepared to start talking about some cardiac diseases, okay? Yes, sir.